Hello? Hi, everyone. Sorry, I'm off camera today. I'm not doing too well.
Hey Julio, no worries. There we go. No worries, and I hope that you feel well again soon.
Thank you. I see Steve is muted.
I don't know.
All right, we're gonna try it all over again.
Hear you now. Great.
You can hear me now?
Yes, I can.
Okay, very good. All right, thank you. All right, so welcome everyone to this meeting of the Community Board 12 Manhattan Health and Environment Committee, April the 3rd of 2025. We're gonna get the show on the road in just a moment. Want to introduce my great fellow committee members, Jacob Banis, Heidi Guzman, Carmen Paulino, Jody Herzon, and I think hopefully we'll be joined shortly by our Assistant Chair, O.C. Kamina, and maybe by Richard Allman, because he didn't indicate that he wouldn't be coming, so I assume he will be coming. And that would that rounds out our committee membership. So we have, as usual, we have a guest presentation, and then we have our usual reports from the Health Department, from New York Presbyterian Hospital, and from Columbia University Irving Medical Center. For the first time in recorded history, well, in recent history, our representative from Isabella Geriatric Center is not able to join us tonight. So we have given her a pass and expect her to come to our next meeting, or the meeting after that one. So why don't we begin with a presentation about biobanking at the Columbia University Irving Medical Center, and giving us this presentation is Danielle Pendrick, the Director of Interdisciplinary Research Initiatives. What a
I know,
That's it.
right? I chose that title.
You chose
I
it.
don't know what I was thinking.
Yeah. It sounds very impressive.
It does not roll off the tongue.
But no, it doesn't, but it is very impressive. So we're gonna find out all of, at least some of these interdisciplinary research initiatives tonight. But biobanking, when Diego gave us a very brief blurb about biobanking a few months ago, it really piqued our interest. He said, what the heck is bio?
Oh, okay, good.
So what the heck is this biobanking? And how much interest do you get if you open up an account? So
We'll be quite disappointed by that answer.
we're gonna be disappointed, okay. You don't get that much interest. I should mention, we're also joined by the first vice chair of our board, Anthony Viola.
Hello.
So Danielle, you have a PowerPoint presentation
I
or?
do. Yeah.
Okay,
Do you want me to stand somewhere? or-
well, but yeah, maybe, you could stand near the laptop.
Okay, sure.
We're just doing a little bit of technical migration
Oh,
over here.
So
Try to
I'll,
get it here to get it over there.
so we're not ready yet?
We're not ready yet.
Oh,
I think I can screen share it if you want me to do that for you. I
Yeah.
just can't take the minutes at the same time, so
Yeah.
it's fine, but
okay, okay, let me just kill a little more time maybe. So I tell you, we're meeting at a point, we're just about 5 years after the the worst peak of the COVID-19 pandemic in 2020. Was actually, I think, maybe it was yesterday, with hospitals that were overwhelmed with, and there were more than 500 people reported dying in a single day. So at some point, actually, I wrote to the to our various representatives. I'd love to hear from them as to what the hospital and what the university and what Isabella have learned in this, from COVID-19. And as I said at a meeting at the CUNY Grad Center last night, as far as I'm concerned, the pandemic is not over. I'll give my usual report in a little while, but people in this community and elsewhere around the world, I guess, are still getting sick from COVID. They may not be dying in the same numbers that they were dying a few years back, but people are still getting sick. So, I don't think we can just slough off the pandemic.
yeah.
Have we migrated? No. Is this
Whatever, sure.
a legal migration, I hope? And then the other thing I want to mention is this is such a difficult time, obviously, to be advocating for more health services and for doing what we normally do in an environment where the federal government is like going haywire, cutting health services willy-nilly, without any real thought or comprehension of how it's impacting people in our country and in our state. You know, I sent you all an article a few days back about the impact on our state at this point. We're losing, maybe $360 million for public health services, and we're still waiting to see how that's going to translate in the new state budget and how that's going to and then filter down to the city when the city adopts its budget. So this is a really hard time, and we still have to do what we need to do. We still need to advocate for health services and what this community needs. But the picture, obviously, on the federal level is pretty bad, and people running the federal government don't seem to care, which is really, we've never really had a situation like this, at least in recent history. And obviously the university is suffering. The university is still under threat of losing $400 million in research grants, and much of that money is spent right here across the street in the medical center. And we don't really know the full impact yet of how that's going to pan out, and then we don't know if that's going to be the entire amount that the Trump administration is going to cut from the university. They seem to be out for blood almost. So
I think Jacob is.
Yeah, I'll read this.
Yeah.
okay, all right. So let's now that I've set an optimistic tone, why don't we begin our presentation with a very happy picture of the biobank resource for investigating disease, genes, and the environment, and the Columbia University Biobank. And tell us where is this actually taking place?
So this is in the new laboratory, the Bridge Laboratory, that was just opened in November of last year. It's in the basement of the Alan Rosenfeld Building, or the School of Public Health.
Oh, yeah.
Yeah, so it's right around the corner. And this,
Well, this is at the old Psychiatric Institute building at the far end of 168th Street.
it is, I don't think it's like, I don't know. It's in Mailman, like the Mailman School of Public Health.
Yeah, but it's at to the western end of 168th Street.
Yes, exactly.
Yeah, that used to be the New York State Psychiatric Institute. Yeah, before they built a new building on the other side of Riverside Drive.
Oh, I see.
So, in fact, this community board at one point used to meet in the 8th floor auditorium of that building.
It's a nice building.
I hope so. It's very good to see that the School of Public Health now has its own building.
Yes. So this is a photo of the interim dean for the medical center, Jim McKiernan, and this is our recruitment and enrollment team and our IT team as well. And they're, cutting the ribbon. It was a celebratory day. We got a grant to build this new biobank in 2020, I think, and it took 4 years of construction delays and a lot of red tape to finally get to the finish line. So it was a happy day.
I don't see you in the picture.
Yeah. I'm gonna Photoshop myself then. I think.
Oh, yeah.
Just
Okay.
say you were taking the photo.
There you go.
That would have been a good answer.
Okay.
Next time.
All right. So tell us, what is the bio? Okay. Go ahead with your presentation. I got you. By the end, I want to know everything I can about the biobank.
Please stop me at any time with questions. I give this presentation a lot to a bunch of different kind of stakeholders, but I almost give it so much that I can't even hear the words in my own head anymore. So if something does not make sense or you feel like I'm not explaining it well, please stop me. So I'm going to be talking about two what we call institutional core resources, or services offered at the medical center that are supported by the dean's office funding. And core resources typically are available to any investigator at the medical center or at downtown to use. So that's kind of how we, define core resources. One is this Bridge facility, or the new automated, or the new laboratory and biobank facility. And the other one is the Columbia University Biobank, or kind of the research protocol side of things that, I'll go into more detail, but through the CUB, as we call it, we aim to enroll every patient of the medical, or approach every patient of the medical center and NYP at some point during their care with an invitation to enroll. So I think if there are no other questions, we okay.
Is it dependent upon, a federal grant?
No,
Oh, good,
thankfully,
Good.
no.
Okay, great,
Yeah.
okay.
It's a good question.
Great question, but thankfully no. Although because it's funded through the dean's office, it is dependent on indirect costs. So the more grants we lose, the less indirect costs we have, so. So this is a snapshot of the new biobank facility. So first I'm gonna talk about the bridge, and then I'll go into talk about the CUB. So the bridge is, as I mentioned before, it's a brand new on-campus laboratory. We just opened it last November. And the goal of this bridge facility is to be able to offer biobanking services. So sample processing, patient recruitment, annotation, which means like we capture quality information about the samples that are processed, and long or short-term storage. To any researcher at the medical center or downtown. We initially submitted a CO6 construction grant for the bridge, again, back in like 2019, it was pre-pandemic, because all across the medical center, there are investigators who have their own biobanking labs, but they're like in -80 freezers, which are incredibly energy and space inefficient. And so the thought was, by offering this new facility that was kind of centralized, that investigators could just kind of put their samples in, or give us their samples to process and store. And it would free up space and free up energy cost and electricity cost, and be more kind of like a green option for biobanking at Columbia. And then the Columbia University Biobank, which again I'll talk about later. This is a research study. It was approved by our IRB in 2020, in March of 2020. Actually, it was really, really bad timing. We have enrolled almost 14,000 participants so far, and banked over 60,000 individual samples from them. And the goal of the Columbia University Biobank is to provide kind of a library of patient samples and health data that investigators at the medical center, and again in downtown, can use in their research. The materials collected are available for sharing with external industry partners. We have a sample and data access committee that oversees all requests for samples, and we have very strict requirements for external and industry partnerships. And then again, I'll go a little bit more into the but it's, we kind of build this biobank, or this library, by working with research groups and units and departments that are interested in kind of building biobanks for supporting their own research, but also doing it under our institutional umbrella. Yes.
Can you share some of those strict requirements that you say to share samples with external partners?
Yeah, so depending on whether it's like an external partner at like a Weill Cornell or an NYU, those are a little bit less strict requirements, and like it depends on the type of research that's happening. We cannot share samples ever with identifiers, so like with patient information externally. In industry partnerships, we have not embarked on any of them yet, but we could only work with industry in the context of like a research study or a research collaboration. So we are very clear in our consent form that like we will never share your samples, we will never sell them for sure. We will never share them like with patient identifiers. But we may share them with external partners, because you have to be really clear in the consent form about how exactly you're going to use these samples.
Thank you.
So all 60,000 samples are here in this lab?
Yeah.
Yeah.
Go to the next slide, please. So at the bottom, or I guess I'll start at the top. So the kind of the central, kind of, I don't know, like the most important part, I think, of this new laboratory that we built is this very expensive, very large automated freezer, meaning it functions off of robotics. So on the bottom right hand picture, you can see this is a shot inside of the freezer. So every single one of those little boxes is filled with racks that holds 96 tubes. So the freezer itself is 40 feet long, it's quite large, and it can hold up to 6 million samples, so it's really high capacity. We have space in the laboratory for 2 of these freezers. We did purchase one. And we anticipate that we will fill up this first one in about 12 years, and then we have space to put the next one in. So I already talked about how it's a core resource, and it's meant to serve Columbia University. The laboratory is quite large, it's 4,000 square feet, which in the, in the scheme of Manhattan, it's actually quite a large laboratory. There's office space, of course. The construction of this was partially funded by an NIH grant. And again, the goal is really just to offer safe and secure storage and also sample processing services for groups at the medical center who have research grants, or if they have, internal funding that they're spending to process samples and they either can't do it in their lab or they don't have a lab themselves, then we'll just do it for them. There are multiple power backups in this facility in case of power failures or flooding. We offer both storage for -80 samples and also we call it ultra low or LM2 storage for samples like cell lines that need to stay alive and that need like very, very low, like more than 100 and -80 freezer temps. And again, the freezer functions off of robotics. So we have a sample management system. It's a web-based system. And when investigator is interested in like accessing their samples, they go onto the website, they key in what samples they want, and then the robotic picker, which you can kind of see a little bit, will pick the samples for them. So traditionally, biobanking, you have a big freezer and someone has to dig through the samples manually. And it's just not a very efficient way of biobanking. It's, a lot of personnel time. So the goal again with this is just to be more energy efficient, space efficient, personnel efficient.
I'm sorry, did you? I think you said there are 96 test tubes in each one of these.
In each one of the racks, yeah.
In each one, and this robot goes into one of them and can select the one test tube you want.
Yeah, because the robot works off of barcode scanners. I forgot to mention that. That was an important part. Yeah. So it's all the tubes that go into the freezer have to have a barcode. And so the robot reads the barcodes and picks the tubes. The freezer was, as you can imagine, very expensive. It was about $1 million.
Wow.
Yeah.
And each tube is one sample.
Each tube is one sample. Yeah.
So like, does it come out? Is there like a tray that contains 96 test tubes and you open up the locker, whatever it is, and it comes out?
Yeah, so the robot will open up the shelf
Yeah.
and pick out the tube and then just like move to the front of the freezer to deposit it in a staging area until the researcher is ready to come pick it up.
It's like Amazon.
Yeah.
Yeah,
Yeah.
hopefully a little bit.
Yeah,
less,
all right.
but-
Well, yeah, but like the same concept,
Exactly.
yeah.
We would also love to welcome you all or anyone who's interested in coming down and seeing how the freezer works.
Oh,
at any
yes.
point in
Yeah,
time.
yeah.
Yeah, that would be great. Yeah, that would be great.
You may be getting to this, but what are the contingencies if something goes wrong, like robot malfunctions, freezer stops working?
Yeah, so the freezer has an LN2 tank as a backup. So basically it has liquid nitrogen so that if there's like a power failure, then the liquid nitrogen kicks in. I think for 96 hours is like the maximum capacity, which doesn't sound like a lot, but there's a lot of investigators who have lost entire like decades worth of work because a freezer, you lose power and a freezer fails and they're not always on like freezer management systems. They don't always get like an alarm that something is wrong. They come in the next day, all of their samples are destroyed. So this is an upgrade.
Isn't there some point when you would dispose of some of the samples, maybe you no longer need them?
Yeah,
Do you keep them for posterity? I mean,
forever.
I
I
mean,
think the thing about researchers is that if you you spend your grant money or your recruitment money on collecting samples and consenting patients and processing the samples, you're very loath to throw these samples away. Because for you, they're very valuable and meaningful. And so that's another problem I think that we have at the medical center is like there's a lot of junk you know, there's a lot of samples that like no one is ever going to use, but people are just not good at like throwing stuff away. So the way that we will guard against that is by charging people for their collection. So this is not free. And so if a group says that they want to store things, we say like, okay, you have to charge, you know, we're paying, it's 7 cents a vial per year. And so if they, you know, there's a cost to it, and we think that's part of kind of like this mental calculation of like, you have to pay for it, then you have to think about it in a way that's like, there's an out-of-pocket cost. Instead of it's just sitting in your laboratory and there's no like out-of-pocket cost for you, you know?
7 cents per year?
Yeah,
I don't know.
Same as plastic bags.
yeah, yeah. But most of these, you know, like
And
a lot
are
of
we
these,
talking basically about blood, or are the samples of blood samples?
some of them are blood samples, some of them are like urine samples. We have people who collect bone marrow samples. Some do like cell lines, like they're making cell lines. Yeah, it's not meant to be like a tissue bank. So it's mostly built around like liquid, what we call liquid biospecimens, which is kind of a gross term. But, yeah. I'm ready to move on to the next slide whenever you are.
Yeah, go ahead.
Okay, so now I'm going to talk about the Columbia University Biobank, or the research study side of things. And I apologize because I don't know how much I guess information or background you have on like research studies or how research is conducted at Columbia, or
We have, make believe we know nothing.
got it. So a research, a research study is like it is like I guess it's kind of a question, right? You have a scientific question. And a biobank is a little bit different because we say we don't have a research question. We want to support a lot of different types of research studies. So we're asking you, a patient of Columbia NYP, to join our biobank, or our library, that we're building this library. And we can't really tell you yet how we're going to use your samples. Here are some examples of the research studies that it could be used to support. Here are the ways we're going to keep your information safe, your health data safe. But at the end of the day, unless you tell us otherwise, you're going to be in the study forever. There's no plans for the study to end. It's what we call longitudinal, or it takes place like over decades and decades.
You could be used, your sample could be used in God knows how many different types of studies. Somebody might come along and need something, and they can look it up to see whether you already have such a sample.
Exactly. And if the type of research that we describe in our consent form is the same type of research that this use case, or like the, we say distributing study is doing, then they don't need to necessarily sign a separate consent form. And the thing about research studies is that usually results, like patients don't get results from the study,
Yeah,
right? We do have.
yeah, that's been one of our complaints.
Yes, and I'm gonna talk about that later. I'm very
Okay.
excited to talk about that. But we do, the one kind of opt-in or checkbox that we ask patients to sign is like, if we do genomic testing and we find something that we call like important to your healthcare, like medical importance, do you want to hear back from us or not? And some patients, most of our patients opt in, but some of them opt out. So that's kind of like the framework of the Columbia University Biobank research study. But so we call it, it's this core resource. So we approach patients depending on what research unit or department that we're working with. Some of them are inpatient, some of them are outpatient. The only eligibility criteria is just you have to be a patient at the medical center. So depending on the research group that we're partnering with, they're the ones who really determine like, these are the kind of patients that we're interested in enrolling. So we're pretty agnostic to that. The study is administered or overseen by the Office for Research, which is the office I work in. We work with the Department of Pathology, who manages the scientific aspects of the storage laboratory. We get partial operational funding from the hospital. And the actual study is really run by a team of recruitment staff and IT staff. We have a community engagement manager. And then, of course, there's laboratory staff that run the lab. I talked about eligibility. In the consent form, we explain that if you want to enroll, which you don't have to enroll, it's not going to affect your care. But if you want to, we're going to look at your health data. We might do genomics research. You can tell us whether you want us to return those results or not. When you enroll, if you are open to it, we will take a blood sample and a urine sample. We will also, if there are residual clinical samples, meaning like you're in the hospital for something, they do a CBC. If you don't want to give us a blood sample, if you don't want us to like stick you, you can also just use your residual specimens. This is also really helpful for the cancer researchers that we work with who get who have patients with cancer who undergo like, cancer resection. So we can use that leftover tissue. We can also collect additional samples, say if a researcher uses your sample and we want to collect additional one, we'll ask them for it. And then the other thing that we tell people is, we want to be able to support other research at the medical center. So we may contact you in the future and say like, hey, do you want to participate in some research study? And you can say no.
Are you is the patient able to track how their, what you called it earlier, the biolipid specimen is used at some point in the future? I can say, hey, can I have some data on what kind of research has been used so far, or no?
Yes, so that is something I'm going to talk about later in the presentation, but that's, yes, that's what we are working towards. We also have a part of our, what we call an addendum or like an extra kind of consent language for different populations, like pediatric, like rare disease or immunology research or cancer research that we call like a living model consent, meaning like researchers could use the tissue to create mouse models or cell lines. So basically samples that are regenerative and can grow. And this requires additional consent language that's above and beyond, because obviously this is a different type of research than like, we're taking your blood sample and we might use it once, and then never again. And then our funding model is that, again, the, institutional funding supports, or they pay for all of the processing and storage of all the samples collected under the biobank. And then we ask the research groups that we work with to pay for what we call the front end cost. So like the research coordinator who does the recruitment for the studies. And that's kind of the carrot that we use.
But some of that could be coming from federal grant.
Yes, yeah, so we have a couple of coordinators in areas that we may have to lay off because those grants were canceled. Yeah. Any questions about, I know this is a lot.
What does ROR stand for?
Return of results.
Oh.
Sorry about that. Okay, I'm ready.
And then EHR?
Electronic health record.
Oh.
Okay, so this is overview of our progress in the last 4 years. So we did a little bit of recruitment during COVID to support COVID related research at the medical center, but mostly research was shut down. And then we didn't really get off the ground until I would say like 2023. And you can see in the last couple of years, we have enrolled a lot of patients.
Yeah, that's impressive, great.
Thank you. So I'm sorry, because this is not showing up very well, but this is kind of an overview of the workflows or the way that we enroll patients, or we call them recruit and enroll. Recruitment means that we are reaching out to you to say like, hey, you're a patient of the medical center. The medical center does research to try to improve healthcare. One way that health research is funded or is supported at the medical center is through the study, the Columbia University Biobank. So because our funding model requires departments or divisions or these research units to pay for the recruitment part of it, we do as much as we can to recruit what we call like ahead of patient appointments, or like we do a lot of recruitment by email. We're also going to start doing recruitment through Epic, through our EHR system. Because we learned after COVID that not a lot of clinicians or like doctors, they don't want research coordinators hanging out in their clinics while they're seeing patients. It gets in the way of patient care. And so we had to develop these methods for inviting patients to participate and sending the consent form by email. Just in order to kind of get out of the clinic's way. We also developed a texting interface so that patients who, are not amenable to email, which is a lot of patients, honestly, can opt in to be texted as well. We can't text people without their permission, they have to tell us. And, depending on the patient, what we call like the cohort or the group of patients that we're trying to enroll, depending on their diagnosis, as you can imagine, some patients are very motivated to participate in research. We see that a lot with patients of the Cancer Center. They, I think, are because a lot of Cancer Center patients are on clinical trials, they're more kind of familiar with being approached for research studies, and we find that they're more open. There's some patients who don't know what research is, and we don't, I think, as an academic medical center, we don't do a great job of introducing patients to research. And so there's a lot of patients, depending on the clinical area who, we don't see a lot of success in recruiting them. So it really just depends. We can also do in-person recruitment. But that tends to be a little bit more expensive because you have someone kind of hanging out in clinic and waiting for patients. And by recruiting patients electronically or through email, we're able to reach larger numbers of patients essentially. We've also developed.
But not everybody has, has computer access.
Right. Right, so that's kind of why we developed the texting interface.
Yeah.
We also will call patients too. And we also do in-person recruitment. Yeah, we wanted to vary the way that we contact people to participate. We know a lot of people don't use email. We developed an Epic-based, or like using our EHR system, Epic, research order for blood collection. That's designed to kind of just hang out in the patient chart until the next time that they're getting a blood draw that's ordered by their physician, so that they don't have to undergo a separate stick to get our order drawn. So we think that's just better for the patient experience. This infographic is not great. Any questions about the workflows?
This reminds me, there was a federal grant that the medical center had.
All of us.
What?
The All of Us study?
Yes.
Yeah.
So
This is not related to the.
it's not related to.
Yeah, that's correct. So All of Us is like it's almost like a federal biobank, but they're very genomics focused. Like they did genomic sequencing or genomic testing on like every patient they enrolled. We don't have the money for that. So we don't do that.
So what happened to all the samples that were collected in that program?
They're stored at the Mayo Biobank, which is somewhere in the Midwest.
Oh, Minnesota.
Oh, okay, yeah.
They're not here.
They're not here.
Oh, okay.
Yeah, All of Us, yeah, they centralized. So any site that enrolls All of Us patients, all those samples are shipped to the Mayo Clinic.
I think maybe the medical center lost that grant. So yeah,
We did lose that credit.
right, okay.
Yeah, fortunately.
Just to connect the dots,
Oh.
because we're talking about potential layoffs.
Yeah.
At the beginning of the presentation, you mentioned that in 12 years, you have the capacity on the first freezer. Was that estimate done prior to the announcement? That
It was,
do you
yeah.
expect that to change based on?
I think it depends on if more grants get canceled, because some of the grants that got canceled involve biobanking or like, taking samples from patients and storing them. But a lot of them did not. So I'm hopeful that we won't lose any more grants, but yeah, I'm sure we will be affected.
Okay.
Yeah. We haven't had to lay off any staff yet, but that may be coming. And I'm also sorry, because I feel like I'm taking a very long time, so I can speed up. Okay, I'm good.
I
Okay.
have another quick question.
Yeah.
Not necessarily related to enrollment, but recruitment. I'm just curious to hear, why would someone do this?
Why
What do
would
you
someone
pitch? Right,
participate?
what do you tell the patient?
Yeah.
What's in it for them?
Yeah.
We tell the patient that what is in it for them is you are donating to like a future. Like, I mean, we talk about future research, but it's more like we rely on people's goodwill. Because there are no immediate results. And we even say like, we can't promise you your sample will ever be used. We may not ever get back to you with any results of medical importance. So you're doing it because of just, yeah, goodwill. And just wanting to kind of participate in research.
There's no compensation.
There is compensation.
Oh,
Yeah,
there
we
is?
compensate participants, it's $20.
Oh.
It's not a lot of money.
Well,
All of us,
Yeah,
Lunch.
all of us did like $25 or something like that too.
yeah. Okay, so I wanted to give you a little bit of insight just into the process for how people access the samples, because I think transparency is really important. So we have a committee that's made up of faculty members from different departments. The goal of the committee is, you know, to oversee and make sure that the samples are being appropriately used, like people are not requesting samples for research that doesn't have any scientific merit. We, you know, that are, if they're proposing to share samples outside the medical center, that the research collaboration is beneficial to both institutions. We also look at what kind of clinical data or what kind of health data is being asked for, because if researchers, you know, depending on the type of research they're doing, maybe they don't need all of the clinical data that they're asking for, maybe they can do with less clinical data. And then we also look at whether they propose to return results to patients. And this process happens over email. If somebody submits a request through our sample management system, it's our web-based system that the freezer robotic functions off of. And then we send that application to the committee and they either say yes or no. Okay. So now is I think the stuff that I'm most interested in. My background is public health. So from the beginning of me working on this biobank study, which was in 2020, I wanted to make sure that there was very strong community engagement aspects to this. Our goal of both our participant engagement and retention strategies is to make sure that patients understand that their donation is incredibly valuable, that they feel like they are partners in this process, because very, very often, as you know, a researcher will say like, I want you to participate in this study. And then it's the last time that people ever hear from them. And it's just not, it's not right. So short term, you know, we have a newsletter where we inform patients about different research studies that, you know, they're just that the biobank supports. We developed a text messaging interface to be able to better engage with people if they're not interested in emails. We have developed a lot of video consent tools. We have what we call a resource library on our website that has like a list of all of the studies or the projects that the biobank supports. We ask for lay summaries from researchers to be able to share with the community in ways that is not like, here's this paper that was published, that's like very dense and hard to read. And then also, since now the biobank is open, we were gonna film a video tour. Funding is on hold for now, but that's under development too. Long term, we are developing a participant portal to be able to provide transparency to people into what samples have been banked on them and the research studies that their samples support. So I developed this idea of a portal through this other research idea of meaningful or dynamic consent, which is the idea that once you enroll in a study, but again, there's like a bi-directional relationship that's formed, where the participant is just as important to the process as a researcher doing the work. So from the beginning, I wanted to make sure that at some point we would be able to, again, provide transparency, because the biobank doesn't benefit people, right? So the only thing that we really have to give is transparency. So we're starting focus group pilots for this summer, which I'm really excited about. It took us a really long time to get here. A genetic counseling student actually applied to do this project with me for their master's thesis, which is really exciting. So we don't have anything in place right now, but we're working towards it. There is no biobank in the US that does anything like this. So this is new. But anyway, so I'm getting emotional about it. I don't know why. It's just really important
Yeah,
that
It's
people
exciting. Yeah.
are like, we don't do a good job with that research. Sorry. Anyway, okay, moving on to the next slide. So we have a community well, we had a community advisory board. Another really important part of this, of course, community advisory board. We initiated that board in February 2023. We brought the board together 4 times, and the initial kind of year that we had an active CAB, we really spent on asking them, like, what do you know about research? Like, how do we introduce you to research in a way where you kind of understand how the research process is? So we did like a mock consent where we had one of our coordinators come in and like consent, one of the board members so they could see how that works. And then at the end of 2023, G.Day Williams Office for Community Health was announced. Are you familiar with? Okay. And so the CAB activities will be moving under his office. So we look forward to them resuming sometime soon.
You had a representative from Board 9, but not from Board 12?
There's probably a lot of organizations that are in Northern Manhattan.
I
know they're really
no
working hard.
excuse, I'm sorry.
I'm sorry, I don't have a good answer for that.
No, there is no answer.
Will it be the
Probably
same
is.
composition?
It's probably that.
I don't
That's a
know.
lot
I
of
think
other
that Dr.
organizations
Williams
in
is
Northern Manhattan.
thinking that he's going to form like a very large research CAB. I don't know who he and Sandra Harris will eventually choose to be on that CAB. I'm not sure.
We're saying,
Well, we can just talk to Sandra.
Yeah.
Yeah, okay.
If you notice, there's a slot open at the bottom underneath rep from CHW, so.
What, I'm sorry?
We could, yeah, sounded really bad. Can you repeat that, Julio?
I think this is.
I said, if you notice on the slide, right next to Fort George and underneath rep from CHW, there is an open slot. So that's, they were thinking of you.
No, that's an interesting spin, Julio. But okay, good try. CHW is what, community health workers?
Yeah.
All right, well, we'll have to take this up with Sandra,
Okay. Great.
but don't give away that empty box.
No, that's for CB12.
Yeah.
Um,
being taped.
okay, great. We're committed to this.
The question is, which one of you are gonna sit on that? So you all want it, but.
You open?
OC, okay, you muted. I'm glad to see you, but mute yourself for the time being. Okay, so there's a partnership with the ambulatory care network.
Yes, so one of the, I guess, I'm trying to think of a nice way to say this. One of the limitations we have currently is because we do a lot of recruitment from Columbia doctors clinics. The CUB patient population is not representative of the Northern Manhattan and Harlem communities. So one way that we want to remedy that is working to recruit in the ACNs.
Yeah.
So I reached out to Elaine Fleck, who's the VP of the ACNs, back in December of 2023. And we're hoping to start recruiting in the ACN spaces. I'm really hoping by summer of this year. But we presented to her a 3-year plan. Again, doing all of the work ourselves. We're not asking anything from the ACN clinics, but to basically make sure that the patient population and the research that eventually is created because of samples collected in the biobank is beneficial to all communities and not just Columbia doctors patients, which are overwhelmingly white middle-aged women.
Right. Yeah, no, that's a very good idea.
Yeah, so you can see right here, our current race and ethnicity breakdown again is, mostly not Hispanic, white. Again, not a problem that we are working to remedy. And then I think the last slide is again, part of the presentation that we provide. Anyway, I don't have, you know, the demographics of Washington Heights, I don't need to provide you with that, but I think that was the last slide. Thank you for inviting me. I really appreciate this opportunity. I'm happy to answer any questions. I'm happy to share our research, like the protocol documents, if you want to see the consent forms or any of our, you know, brochures that we get to patients or any tour.
We used to have the woman who I think oversees the overall IRB clinical trial process.
Brenda
Uh,
Riccolo?
Yes.
Yeah.
Yeah, she's still there?
She is. Yeah.
So if I mean, this, I don't know if this is really pertinent for you, but if I remember correctly, there, between the medical center and downtown, maybe there are 5 different IRBs. And one of our complaints had been that there's a requirement that at least one member of each IRB has to be a civilian.
Right.
Has to be a non-affiliate of the institution. And we had been complaining years ago, I haven't picked up on it lately, that none of those civilians were really from our community, or very few. You know, we were pressing to make sure that we actually had community representation, not necessarily just, you know, non-affiliates from
Sure.
wherever they might come from.
Right.
So especially because you know, we're looking to recruit more people from the community
Right.
to participate in the clinical trials. So we wanted to make sure that that there was direct representation from the community. So I really should get back in touch with.
Was there any
Right.
resolution? Because I'm happy to pick that up with her again.
Oh, good.
Yeah.
But yeah, to tell her that we probably would like her to come back at some point.
Okay.
And then give us an update on that. But yeah, I am wondering where that stands. You
Yeah.
know, we were hoping to have somebody from the community on each one of the IRBs. And if I remember correctly, there wasn't a limitation that you could only have one non-affiliate.
Uh-huh.
You had to have at least one non-affiliate on each of the IRBs. So we weren't saying that you should get rid of anybody. I think we would just
Just
say
additive.
we should just have you know, we should just have people here from the community. As difficult as that might be to recruit them, we did at one point, we were recommending people who could serve on the IRBs. And I think a couple of people we recommended did end up getting appointed.
I think that was her hope with the CAB members is once, you know, they were kind of more oriented to how research worked,
Yeah,
that they could also serve on the IRBs.
yeah,
Which would be great.
or suggest possible members, yes.
Yeah, I'll bring
And,
that up.
and serving on the IRB is not. It's really time consuming, if I remember correctly. It's a big task. And you know, you have to spend hours reviewing maybe a lot of dozens of proposals, you know.
Yeah, it can be very dense too.
Yeah.
Yeah.
But that is the people are compensated for that work, if I remember
They
correctly.
are.
It's more than $20.
I would hope so.
Steve, that's the blank box that was left for Community Board 12 representation, I guess. Is that the one
Well,
you're
that-
talking about?
That's what Julio is telling us.
That's gonna.
Okay, so we have an opportunity.
Yes, we're gonna take that up with Sandra. I mean, that community advisory board at the moment is inactive. Is that correct? So it has to be revived. And when it is revived, I would hope that we would get some we would get a slot there.
Steve, when you reach out to Sandra, can you copy me on that?
Yeah, I'll probably call her, but yeah, okay.
Okay, well, if she asks for,
What?
if she asks for any,
Okay, very good.
Is there any additional information? Was I not? Yeah. And is there anything else?
Um,
I wanna
so,
make
so,
sure
so,
that,
so the difference between the bridge and the biobank, I'm a little confused.
yeah,
The bridge is the actual laboratory
correct.
that houses the samples that are collected through the biobank.
Correct.
Oh,
And other research studies.
yeah.
And then the cub is, yeah, it's we call it like the research study.
Right.
Yeah.
So they're linked together, you know, yeah. And you're in charge of of both of them?
Oh, no.
Oh,
Just the cup.
oh, okay.
Yeah. I don't have a laboratory background. My background is public health. So. Would make a very.
But the laboratory is in the basement of the public health building,
And again, we'd be happy to host you all for a tour anytime.
but the basement is not really a basement.
Right.
The basement is like 8 stories up from Riverside Drive, it was something,
Right.
something like that, I don't know,
Right.
but it's not,
Yeah.
it's not like in a flood zone. It's not,
Right.
yeah.
It's like on the cliff wall or something.
yeah, yeah,
Yeah, so it's right by the pet center. So like there are patients seen in the basement. I don't know why we call it that. The lowest level.
and it's been there for how long?
Just since November.
Really?
I mean, the basement.
This new laboratory,
Oh, yeah, since November.
really, well,
But also it was.
and,
under
and you,
construction for a
and you're saying there's no one else has a laboratory like that?
Maybe other medical centers or hospitals have laboratory, but not at Columbia.
All right, any other questions? All right, Danielle, you did a good job, thank you,
Thank you.
Thank
you
I
so
much.
really appreciate it.
and, you're doing very important work.
Thank you so much. That means a lot to me. Do I stay or do I?
You're welcome.
go.
You're free to go.
You're not compelled to stay, and you're welcome to come back anytime.
Thank you.
If you feel as though there's something new that you want to brief us on, or,
I would love to get back to you after we do these focus groups and we get farther into the
Oh, great.
idea of
That'd
like
be
this portal.
all right, so
Yeah.
maybe in the fall.
Yeah, that would be great.
All right, that would, yeah, well, you can just let me know.
Okay.
Do you now have my email?
I
or-
don't.
Okay, well,
But I can ask Diego.
yeah.
Cause I'll need to get back to you about the IRB thing too.
Yeah, oh, that, I would really appreciate
Of
that.
course, no, that's
And,
important. Yeah.
I've had that on my list of things to do for the longest time,
Happy to take
but I
that.
haven't, and I have Brenda's business card sitting on my desk, but I haven't gotten around to it.
No, I work with her a lot, so that would be easy.
Okay.
Okay, again, thank you. It was lovely to meet you all.
And this is not meant as any criticism of
Sure.
her, it's just that, it would be great if we could, build into the whole process, having more community representation.
I totally understand.
Yeah.
Yeah, cause otherwise, what is the point of having a community board member up here?
Right.
Yeah.
But, and it fits in with what you were suggesting earlier about making sure that there's a reporting mechanism that people know in the end, even if it takes years, you would love to hear back and say that your sample maybe helped, some wonderful health outcome or discovery, or
Yeah,
just helped move the process along some way.
yeah, absolutely.
yeah.
It should be, it should be mandatory for all research studies if
Yeah.
I was in charge, so.
Yeah, my blood did that. I don't know.
Absolutely. Also too,
Yeah.
maybe we didn't use your sample.
Yeah.
You know,
Well, don't tell me that.
so that's part of the focus group question, so you wouldn't wanna know that.
Would you be disappointed?
It would be disappointing.
I think I would.
I don't know. I'd have to think about that. I'd have to think about it. I guess,
would still wanna know.
you still wanna-
Because I
yeah,
would,
yeah,
yeah.
yeah,
because
you
it's
wanna-
Like this sort of limbo thing.
yeah,
right?
yeah. So you wouldn't stay up at night wondering, what did they ever do with my sample?
Yeah,
Whatever happened to that blood and work?
I'd love to get a text message 10 years later that's just like, oh, we didn't use it,
Yeah.
and it's been destroyed, like, oh, okay. I don't know.
My
I would be great if it was used, but.
my blood wasn't good enough.
No. We'll have to think a lot about messaging.
Yeah, okay.
Like
Yeah.
when you adopt a penguin at the zoo and they text you photos, like you just get a photo of your little vial.
Still here.
It's very frozen. A bit of ice on it.
All right, Danielle, thank you.
Thank you.
Thank you very much.
Thank you. All right, next up is Julio Batista, representing New York Presbyterian Hospital. Julio, are you still with us?
Yeah, what happened to Pauline? Pauline usually takes the lead, but thank you nonetheless, Steve.
But Pauline has agreed to concede to you at this point.
Oh, much appreciated. Thank you, and thank you, Pauline.
She wants to make sure that
Did I
you
mute it?
get sufficient rest.
So let me start off with the, with.
But why, we're getting a lot of static from you.
Yeah,
You
give me a
get some,
second.
yeah.
Oh,
So let me start off. Can you hear me now better?
No, hold on one second. This is on our end. I don't know how to get this off the mount. But the last time this happened, it was like a loose wire.
Yeah, we have a technical issue right now. Hold on.
Okay, I gotcha.
I don't know how to use this tripod at all. So that's not cool. I'm afraid to break it. Do you know anything about this
I
tripod?
don't think I.
Hmm. I thought maybe the
That's not that?
no,
That didn't do anything?
no, I don't
Is it
think
like
so.
it physically screws on?
Well, yeah,
I mean, the device itself.
The owl.
did that do
Yeah,
anything?
Yeah. You just. I feel like it's loose.
Not quite.
Not,
We
nothing
can
yet?
hear you.
Yeah, I can hear you guys fine.
Yeah, you're coming through weird on our end. It's
Yeah, we,
Oh, that's my usual self.
oh,
it's
it's a little better now.
definitely like this wire is loose, I think. Oh, look at you. Thank goodness. How many community board members does it take to fix an owl?
Okay.
Here, I think if we could just slide
Yeah.
that off.
Is that better?
Not
Oh,
quite.
hold on.
Thank you.
They're playing with the wires.
I don't even know if that's really the issue, but that's what happened last time this happened. I don't know.
I can see them.
Very intense.
Well, it's,
I can see that this wire is not all the way in.
yeah.
Julio, can you say something?
Yeah.
Yeah, we can hear you. We can
Yeah,
hear
we-
you really well.
We can't hear you well. Hold on.
Okay, fine.
1, 2, 3, 1, 2, 3. Can you hear us?
Yes.
It's like robot-y, so that's the problem.
Okay. Maybe unplug and then plug it again.
Yeah, let me try that on the
Or-
computer.
Owl.
Yeah, hang on. Let's squeeze in here, Steve.
You're gonna come. Great. Let's go.
Reset the whole out.
Oh, you reset it? Okay.
Okay, can you hear us now?
Yeah, that's a lot better.
Can you hear us?
Yeah, we
Yes,
can
we
hear-
can
we can
hear
hear
you
you.
really well. Julio?
Yeah, I can hear them well.
Okay.
We almost broke the tripod, but we fixed it.
Okay, we're back.
Now I remember how to do that the next time.
Okay.
All right,
Except that we can't see the room. Well, no,
Oh, hold on.
it's
Yeah, see-
okay. I mean,
It's not okay, actually.
Probably press the button for the camera or something.
Yeah. I don't know if it's on Zoom or on the owl. 1 second.
At least we know it says Community Board 12 behind though.
That's good.
But the camera's facing the wrong way.
No.
Is it this button?
Maybe.
It works, a
We
blank
just don't
box is
have our
now
video
assembled.
on. Hold on. Here we
Oh,
go.
there we
oh, you're back.
We can see you.
Perfect.
See you.
Now-
perfect.
Yeah.
Software issues. Okay.
Okay, we're ready.
All right,
All
so
right.
let me just start off by.
Oh, very good.
Sounds great. Great job.
Yeah,
I'm sure.
sound quality is 100% better.
Spectacular.
Yeah, go ahead, Julio.
Thanks, Jacob. So let me start off where Steve ended off with the COVID. I decided to also look at our numbers this month compared to last month. And as you recall, it appears like during the summer, or as we get to summer, there appeared to be a spike in the past. So, and I'm trying to see whether that is sort of where we're going. So this particular month, I checked 2 days ago. I apologize, I haven't been in the office for a week and a half now. But
Oh,
the report I got was that system-wide, we have 130 patients, COVID patients, compared to 105 when we last met in March. At Columbia, we have 34 patients as compared to 31 last time. At the island, we have 9 patients as compared to 3 last time. And at Morgan Stanley, we have 5 patients compared to 2. So this month, within the last day or so, we have 45 patients at the hospital compared to 36 when we met in early March. So, and so Steve is correct. By far, we're not, I've not overcome the COVID. Unfortunately, it's still lingering. It's still there. So, just also want to report that the Allen Hospital psych beds are on target. They should be completed later this month. We will then get, or we'll hopefully get the approval from the New York State Department of Health to open those beds, and hopefully in early May, by that time we'll have been approved, and the operations there of the psych beds will reopen. So that is the update with the psych beds. Just also let you know in terms of the construction, the Broadway location is almost done. They've they gonna start with the residential building there. They started already. And as I mentioned, once that demolition is completed, we would turn over the project to Columbia University for them to do the actual construction. The project at the Cancer Plus building, which is the ambulatory care building, bringing together all our cancer services. We've more or less have done the demolition. We're in the process of doing excavation at that location, and then they will start doing later, hopefully within a month or so, they will start doing the foundation work of that site. So those are the 3 things I wanted to update this committee. I'm not sure, Steve, if you have any questions or any committee members.
Yeah, I think as I also wrote to you and I mentioned last month, there were supposed to be 3 more psych beds added at Milstein. Were you able to find out what's happening with that?
So for Milstein, as I'm not sure if you recall, that Milstein site needs to be brought up to code. So all the psych patients will be all seen. Those who need to be admitted will all be seen or housed at the Allen Hospital. They will start demolition of the psych unit at Milstein 9th floor for that to be brought up to code. And then we'll reopen with, and again, I have to confirm this, Steve. I know there was a net gain. I just need to find out whether there's a net gain of 3.
Yeah,
There will be a net gain.
that's what we were told previously. It would be that in the end we would only have a net loss of 3 beds from the 30 that were originally at Allen.
Right. So the idea is that once what is completed, there'll be a net gain at the Milstein Hospital.
Yeah. Okay, but and you'll confirm that it's another 3 beds.
Not only that, but I'll confirm sort of the schedule in terms of
Right.
The process. I know that they may start in May with the decantering of the space, so they could do demolition. But I'll follow up and give you the specifics for next meeting in terms of the timeline that we have.
So how many beds are we getting total?
So there will be 26 at the Allen. I have to, I didn't look at
24.
26 at the Allen.
I thought it was 24. No?
I thought it was 26. I'll confirm it, but I thought it was 26 beds.
More beds.
No, that's you're right. I'm sorry, Jacob is right. I'll take the 26, of course. Yeah, what
should be 20.
Yeah, why am I underbidding myself? Yeah, yes, thank you. That's great news. Thank you very much.
Wait, I didn't get the full answer here. So how many beds are we getting total?
Okay,
So-
we're not sure right now.
Yeah, I just have to make sure what the, we have a 3 net gain at Milstein. I just need to come back to the committee with the current number. I think they're like 9 beds maybe at Milstein. I'm not quite sure, but I'll give you those figures by next meeting.
So it's 26 at the Allen, and the X is whatever it is you're gonna get back to us about Millston.
Right, it will probably be 9 plus 3 plus 26.
Steve, are you listening?
Yes, I can't believe what I'm listening to. Yes, it sounds great. So that would mean that in the end, there would have been a net loss of only 1 bed.
Mhm.
Okay, all right, that's so much better news than than we've had in a while.
Okay, but we
so-
just need the confirmation for all
Yeah.
of this.
I will, and I'll share that with you.
So shortly after the beds are reopened at the Allen, then the unit at Milstein is going to undergo renovation in order to be brought up to code. So those beds will be offline for some period of time while that renovation is going on.
Correct.
Okay, and in the meantime, the patients are still going to be oh shoot, they're still going to be screened at the is it, oh God, is it called the CPEP unit? What is it called?
The PEP unit. So patients, regardless of whether they come to the Allen
Which is down here at 168th Street.
or 168th Street, will be evaluated, at the CPAP, right? CPAP unit at 168th Street. They
Right.
would then, if it's determined that they need to be admitted, then
Right.
they will be taken up to the Allen.
Yeah, well, that's basically how the process has worked in the past.
Correct.
Okay, and shoot, what was I had another question. Where did it go? All right, I don't remember.
So wait, the number of beds we're getting at Millston will be, those gonna be like a floating kind of beds, or because you said that they're moving to. Okay, could you repeat what you just said about Allen?
Let me just repeat that, OC. So this is what happens. It happened in the past and will continue to be the process. When someone needs to come into the hospital for evaluation, whether it's, and it's been the case, has not stopped, whether at the Allen or at the emergency room at 168th Street, they are seen and evaluated at the CPEP unit which is the emergency component for mental health. If after the evaluation and seeing it's determined by the physician that this patient needs to be admitted, then that patient will will either go up to Milstein, which is going to be closed for a while, or go to the Allen Hospital where they will be admitted. So this the CPAP is just a holding place to evaluate and ensure that this person needs to either be sent home or be admitted.
I get it, but what my question is, let's say, okay, the beds that will be designated at Millston, those 9 beds. So what that means that you're gonna have a psych bed in Millston and also at Allen. It's not that they're going to send everyone to Allen and not. The
Right.
byline is some patients can be admitted to Millston.
Up to the currently,
Up to
yes.
9.
Currently, yes.
Okay.
Come May, when the space will be renovated and brought to code, those patients will not be sent up to Millstein because the space is being under renovation. They will be sent up to the Allen Hospital until that unit opens up again.
Okay, got it.
But hold it a second, but when it does reopen, presumably it's going to be expanded from the current 9 beds to 12, so that we pick up those 3 additional beds.
Correct, yes. You're correct, Steve.
Okay, very good. Now, is there any news about the inpatient rehab beds?
So the last I heard was that the application was submitted to the state. I have not gotten any feedback in terms of if the state is asking for additional information or if they intend to approve it. I would, I would get back to you on that before, within the next couple of days.
All right, would appreciate that.
Yeah.
All right, any questions for Julio? Apparently none. Well,
It'd be great if you can get confirmation on the number before the 22nd, so you can report it to the full board.
that's true. Very good.
Yeah, I'll share that information.
All right, thank you.
Sure.
All right, thank you, Julio, and get some rest.
Thank you, Steve.
All right, Pauline, are you still with us? Pauline Ferrante.
Hi,
Our-
everyone.
Oh, God, I love hearing that voice.
I'm still here. I thought you were going to replace me for Martha, because you sent her that meeting invite, and I said, "Oh man, they don't want me to
No,
come."
no, I'm sorry. No, you're stuck with us. No,
I'm just joking. I'm happy to be here.
no, I don't know how Martha got invited to tonight's meeting. Did I copy you on my response to her?
You
I
did,
told-
yes.
Okay, yeah, I told her we do want her to come back and give us an update, but not this soon.
Yes, exactly.
All right, so, Pauline, you can, I have to give my little report. So the latest statistics on COVID-19, taken from the Department of Health and Mental Hygiene website, just today, fresh off the website. Zip code 34 did not do very well in terms of its hospitalization rate during the 28-day period from February 21st to March the 20th. It actually ranked number 7 in the entire city, which is pretty high. I mean, 28.4 hospitalizations per 100,000 people. But very unusual that it would be that any of our zip codes would be so high on the list. The others were much further down. Zip code 32 had 12.7 hospitalizations, ranked at number 51. Zip code 33 had 12 hospitalizations per 100,000, ranked at number 57. And zip code 40 had, I don't know, 0 or something around 0, and is ranked at number 128. In terms of the total cases since we last met on March the 6th, I believe, 368 new cases. It's a lot of cases. So COVID has not really gone away, but fortunately, no more deaths. We still stayed at 1,042 deaths since the beginning of COVID over the last 5 years. So, Pauline, I turn it over to you, and you can talk about COVID and all other diseases.
Sounds good. I'm just going to share my screen. So this is the influenza report that you are all well aware of, week ending March 22nd. So I think April is technically the end of flu season. And so we are not really tracking anymore. But as you can see, there were decreases in flu and in RSV as well. So that's all good news. Hopefully, we won't see too many more cases of COVID as the weather warms up. April is the beginning of mosquito season. So 311 is now taking calls for standing water. If you do see standing water in the street, though, 311 will not take that complaint if it's within 5 days of a rain event. And if there's ponding on a street, on a roadway, that needs to be called into DOT so that they can address that ponding situation. Again, I'd like to highlight our press release page, and our latest announcement was declaration challenging the federal government's termination of infectious disease grants. This goes into your question, Steve, about how the agency has changed post-COVID. I would highly recommend everyone go to this citymeetings.nyc, where they broadcast all city council hearings. And this was our health hearing with the health committee. And everything that I have up here tabbed, I'm sending to Steve in a link to share with everyone. So you'll have this information. But this was specifically related to how the health department had to pivot some things post-COVID, how we responded. And then also in that quick summary, this is just one snippet. They have video of the entire hearing. So if you're interested in watching that, you can watch that. But in the response there, Acting Commissioner Michelle Morse spoke about the COVID-19 response review report, which the city had put together after, the dust settled a little bit, so that they can go over, how the city responded, but then also provide recommendations across city agencies. So I think that's a really interesting read for anyone who would like to see how the city, what we learned from the response and how the city is pivoting, and also the suggestions that are made to improve our response in the future. But again, this will take funding, and with the federal grants being cut, all of this is going to be extremely challenging. So I wanted to also touch base about a health morning that we worked with the council member's office on. Councilmember Carmen De La Rosa. We were notified that in the Washington Heights Inwood area, this particular push out pesticide was being sold. And so they put together a press conference. Our poison control expert went to that press conference. Telemundo covered it, and I believe Pix11 covered it, but it wasn't really widely covered. So we just wanted to give the community board a heads up that this is zinc phosphide, I believe. And when it comes in contact with water, it produces a noxious gas, and it could be very dangerous and potentially deadly as well. So we have this in English, Spanish, and in French. I will be sending that to you, Steve, in an email as well. So if you see any vendors selling this particular one called Push Out on the streets, please let us know. DSNY should have gone out already to eliminate, to safely remove the stock from the streets. So hopefully you don't see any more. But if you do, please notify me and notify DSNY so that they can safely remove it. And that, people should not be using it, as it's highly dangerous, and it's also not legal in the United States. So it's like a forbidden sort of chemical here. And then I know that OC is always interested in rabies cases. Manhattan is doing very well. So this is as of the 17th of March. And we still, thankfully, have no rabies cases in Manhattan. So all of these links, again, I'm happy to send over to Steve. And if you have any questions for me, I'm happy to answer them.
All right, very good. Thank you.
How are the roosters going?
Oh, yes. So the roosters, so according to our team, they said that the 34th precinct went and gathered all of the roosters and brought them to the Queens ACC facility. So hens are allowed in New York City. So you are allowed to keep hens as pets in New York City. So the PD did not remove them from the premises. However, OC, I know you sent a photo this morning of a lone rooster. I sent that over to our team. I don't know what the status is on that yet, so I will be happy to check. But I'm not sure if you were in contact with the 34th precinct to maybe get some more information, since they handled the removal, and they also may have issued some violations or summonses for like animal cruelty or something like that. But I don't have the details to what
So
violations.
I sent an email, thank you for the update. I sent an email to Steve and Community Board 12 office to see if they can get any update from the 34th precinct. And so far, I didn't hear anything from the ASPCA.
Okay, I mean, the ASPCA has that legal arm where they work with, or they have like enforcement officers within their teams to be able to respond to these things. But I don't recall, there was a gentleman who was a retired NYPD officer who now works at the ASPCA. I believe his name is Mike Dugan. I can reach out to him and see if he will be able to be helpful in this. But since the roosters have already been relocated to the ACC, I think that particular issue might not, like, I think the 34th precinct might have resolved that issue already. But in terms of like other animal cruelty cases in this particular location, I can refer that to Mike over at the ASPCA.
Okay, that would be great, because if there is one rooster, there is a possibility that he is hiding more in his apartment and we just don't know about that.
Right. No, absolutely.
But how can you just keep, I mean, even if you're allowed to keep hens, I mean, I can't believe this. How can you just have like your own little animal yard in the courtyard of a building? How can that be allowed?
Yeah, I mean that would have to be like a civil matter, I think, with the building owner and the
Yeah.
tenant, you know, like we
Yeah.
can issue violations for animal
Yeah.
you know, hoarding an animal that is not legal in New York, but we can't resolve if the landlord is allowing this behavior.
Yeah, this is crazy. How can this landlord be allowing this?
Yeah, I don't know. I don't know.
And
Maybe
I'm-
he's getting eggs for free.
Yeah, God,
A
maybe.
rooster?
So
The hens. The hens.
no, he has lots of hens apparently too. So maybe
And
he, you know, it's like a trade-off because egg prices were so high.
Oh, my God. But don't hens make noise too?
Not really. They sound more like pigeons, maybe like when pigeons coo. It's the roosters that make all the noise.
Well,
Okay, yeah, go ahead.
I was
Jake.
gonna say, so I asked the 34th precinct about this last night at our public safety meeting, and the officer who was attending our meeting had just come on duty and did not have an update on the situation. He hadn't been briefed on it yet. But I tried to follow up this afternoon with Officer Navarrete from the 34th, and I haven't heard back from him yet either. So I'll keep on it just to confirm. But if the roosters are indeed gone, then that seems like significant improvement for the people who live there at least.
Well, there's
I-
one lone
Yes.
rooster
Barring the lone rooster, yeah.
roaming
I'll follow
about.
up. Yeah, I'll continue to follow up on that front, so.
Great, thank you.
Thanks.
Well, that rooster could be squawking like crazy. Well, wondering where all his friends are. So what a crazy situation this is. This
Mhm.
has been. I get, it helps to get coverage on, was it Channel 7
Mhm,
in the New York Post, and
yeah.
then now finally it's being addressed. All right, is there any other questions for, how are we doing on measles?
Oh, the city is doing okay. There's a travel warning on measles. As you know, someone from DC traveling on the Amtrak came through New York City, and then someone flew into Newark and went all about New Jersey, who tested positive for measles as well. So again, it's really important that you, if you have young children, that they get their MMR vaccine in the time frame that is specified by their pediatrician, and that is recommended by the CDC. And then also, you know, if you are an adult and you're concerned about your immunization status, you can always get like a blood test done, and you can test whether or not you are still immune or if you need a booster. So again, it's highly recommended that you pay attention to where you're traveling to as well. If there are travel warnings about measles, try avoiding those areas as well. But really, vaccination is the most important.
And how do you determine whether you need a booster?
You can get a blood test. You can ask your doctor to give you a blood test and ask, you know, say you're concerned about whether or not you still have a strong immunity and whether or not you need an MMR booster. Apparently, your body metabolizes the vaccine. And so as you get older, it might not be as strong. And so you can get a booster.
So
What about
So she
Bird
gets,
flu.
No.
Carmen is asking about the norovirus.
Norovirus, it hasn't been a huge concern. We haven't really been hearing anything about norovirus, thank goodness.
All right, very good. OC, you had a question?
Yeah, bird flu, hopefully none in our area?
Yeah, no, there's been no further updates on bird flu either. Again, I mean, I know people were concerned about Arden, the Arden place, is it Arden Street? So if you're not in close proximity and working and handling a bird, you have very, very low chances of contracting bird flu. So as long as the other residents in that building are not touching and playing with the chickens or handling them in any way, there really is a very low risk. But again, there has not been any new cases.
Great, thank you.
Right, so that's good news as well. Okay, very good. Any other questions? All right, Pauline, thank you so much.
Thank you.
All right, so we do, I don't see Diego. He did send us a report.
I'm here. I could read through the
Oh.
report.
Oh, my gosh. Diego, go, I'm sorry, I didn't see you. Why does it
Okay.
show up?
He's not on camera.
Yeah, he's just speaking.
Okay, all right, guys, Diego, go ahead.
Good evening, everyone. Happy April. So these are my updates. So on the research side, Columbia students build assistive devices to empower local children with disabilities. So students at Columbia University, Vagelos College of Physicians and Surgeons, their occupational therapy program, they built 20 assistive devices which help children with disabilities to be able to move their bodies safely. This will help them, eat meals, play games, or work on school assignments, for example. And the link is on the sheet. Also, a study by researchers at Columbia University Mailman School of Public Health and the Department of Psychiatry at Vagelos College of Physicians and Surgeons. They found that access to psychotherapy has risen substantially among U.S. adults with mild to moderate distress since 2018. The increase is notable among younger adults, women, college-educated individuals, and those with higher family incomes. Another one is ultrasound, how it's transforming care for inflammatory bowel disease. So as everyone knows, it's a well-known tool for monitoring pregnancy, but it's also expanded into other areas, including gastroenterology, where it is transforming how doctors monitor chronic conditions like inflammatory bowel disease. And Dr. Pecoraro, he's an associate professor of pediatrics at Columbia, and he's also the director of the Pediatric IBD Center. He discusses more in this article, which are also linked here as well. And then some other updates are Bakersfield Summer Sports Camp Scholarship application is still open. The deadline is Wednesday, April 9th. And just a quick reminder, the camps are available for children ages 6 to 14 who reside in Washington Heights and Inwood. Also, the ASPREP applications, the State Pre-College Enrichment Program, they're also still out, and the deadline for that is April 15th. And again, just a brief reminder, ASPREP is a free high school and college preparatory program designed for 7th to 12th graders who are interested in pursuing careers in medicine or other related STEM fields. And the Hispanic Student Dental Organization, they will be hosting a small event or tabling at Haven Plaza on April 10th from 11:25 a.m. to 12:45 p.m. to provide oral health information and products to the community completely free. Also, the Neurodiversity Day, which is hosted by the Neurodivergent at Columbia. This is a day of learning, connection, exploration, designed to deepen understanding of neurodiversity and highlight the communities and resources that support it. There will be panel discussions, real-life perspectives from scientists, educators, advocates, and families, And this event will be held on Friday, April 11th from 10 to 4 at the Columbia's Jerome L. Green Science Center. This will be a hybrid event, and the link is also on the article. There's also another event called Saturday Science, Science in the City Celebrating Earth Day. So this is targeted towards families and community groups. They're welcome to learn about the human body and the brain and how they work in harmony with the environment through hands-on activities and other unique scientific resources. This event is also free and will be held on April 19th from 1 p.m. to 4 p.m. also at the Jerome L. Green Science Center. And I also included the link to register there as well. Columbia University's Public Safety, they're also hosting an event called Ride Your Bike to Work Day, which will be on April 24th from 8 a.m. to 4 p.m. There will be bike registration with CU Public Safety and the NYPD, bike tune-ups, public safety programs and services, and much more. And this event is also open to the public. And finally, a quick highlight, the Dyckman Institute Scholarship Awardees. The Dyckman Institute Scholarship is one of over 300 need-based scholarships available to Columbia students. So this scholarship assists students from Marshall Heights and Inwood who would not otherwise be able to afford the full cost of attending Columbia. And 4 of our local students were awarded this scholarship on March 25th. And that's all for my updates.
Great.
Thank you.
We should probably mention that the Jerome Green Science Center is down at Broadway and 125th Street, I
That
believe.
is correct. Yes.
What, 129th Street,
Yeah, by the one train.
right? It's what is that other one, like a forum or something? Is it, what is it, 125th? Yeah, right. All right, any questions for Diego? So, Diego, so you were listening in earlier when we spoke about that community advisory board for the biobank?
Yes.
right, so-
I will bring
so
that up
you-
with Sandra.
Yeah, bring that back to Sandra, thank you.
I will. No worries. Thank you.
Okay, and anything else? All right, thank you very much, Diego. And thank you for arranging for Danielle to come here tonight.
Of course. Thank you so much.
All righty, and actually, what was tell me a little more about your suggestion for the other program, Yes in the Heights, to come to the committee. What, tell us a little bit about that program.
Yes, in the Heights. So they're also sort of a research-based program. Their program usually runs in the summer, if I'm not mistaken. It stands for Youth Enjoy Science Training and Health Equity, highlighting environmental inequities and growing neighborhood teachers and students. Pretty long, but now it's called it was called CURE, Continuing Umbrella for Research Experience. That was their old name, CURE, but now they're called Yes in the Heights. So they do cancer research with the National Cancer Institute's Youth Science Research Program, and they're Marshall Heights and Inwood based, and their focus is to reduce the cancer burden through training and mentorship. And it's like, I think, an 8-week program, which includes a formal orientation and hands-on scientific training, as well as training in academic etiquette and professionalism and other things relating to that.
And so where is that 8-week program? Is that over the summer? When
Yes,
is
it's a 2-year program, and participants, they are paid 8 weeks for full-time work, which is 34 hours per week. So it consists of 2 summers. Mhm.
It takes place over the summer, okay. All right, well, we're still trying to, I'm still trying to sort out our schedule for the next couple of months, but I think, as I told you, maybe we could fit them in June, but we'll have to see.
Yeah, okay, yeah, please let me know.
Okay.
She's really adamant about presenting.
I'm sorry?
She's really adamant about presenting. She really wants to come in and present to you
And
and the board.
and who wants to do that?
I forgot her name from the top of my head, but
Oh, the director, the director of that.
yeah.
Okay. Okay, very good. All right, well, we'll try to do that. So
Okay.
I'll get back to you.
Sounds good. Thank you so much.
All right, thank you. All right, so as I mentioned, Diane Ashley is not joining us tonight. So on to old business. Still don't have updated street and sidewalk cleanliness, ratings. We didn't get, the monthly report from DEP on the service request. On the recycling side, looks as though we actually made, a decent amount of progress, since the, last report, which was for November of last year, I guess. And so, the diversion rate for, January of 2025, on the recycling diversion rate is 17.7%, which is a couple of points higher than where it was in November. And it was actually also a slight improvement over the year before, which was at 17.4%. So, anything that gets us up towards 20% is, pretty good. We really want to be at least at 20%, if not higher. Almost every other board in Manhattan is above 20, is at 20 or above. At least 8 of the other boards are. Is there any other, do I have any other old business?
Yes.
I have, I'll be with you in a moment. We did get an email from, the Lower East Side Ecology Center, which is interested in doing, outreach around the curbside, composting, program. They're asking us if there are any upcoming, community outreach events will be helpful for us to speak with, constituents in your district. So, if you have any suggestions, please, pass them along to me and I'll send them on. I'm going to certainly suggest that they set up tables at our 3 green markets. That would seem to be a logical place, where they could do education and where, they should have a receptive audience.
Who sent that email?
The Lower East Side Ecology Center. They're doing, I don't know if they must have a grant from the city, I assume. They're doing, outreach around, curbside composting.
While you're on that topic, DSNY, they have composting info session on April 10th from 4 to 4:30. You can register online, and also on April 24th at 6 p.m. Both are virtual. My mom literally just asked me about this earlier today. She's like, what am I supposed to do now? And I was just like, we'll find you something online to watch. So this would actually be very helpful.
All right,
Some education in our community.
Could you send that around to us?
Yeah, of course.
And we should also send it to Ebenezer. We should put that in the Read Board newsletter. Is Julio still with us? No. Okay.
I'm still here, Steve.
Great. So I also received from somebody at the New York Academy of Medicine an email saying that they're working with NYP to conduct a community health needs assessment. So this is part of the normal process, isn't it? They're conducting surveys and doing focus groups with community members in order to incorporate their perspectives on the most important health issues in their communities.
Yes.
Are they gearing up for that? What is it? Every 3-year?
The community service plan.
Yeah. So this is part of that.
So that is part of that. The reason why you were gotten it from the New York Academy of Medicine is because, we need to get someone who's impartial, who's not affiliated with the hospital. So we partnered with them as we did last time for them to conduct these surveys throughout the communities and come up with some of the answers.
All right. So you're gearing up to do another one in the community service plan within the next year or so. Is that?
Yeah. Correct. Yeah. By the end of this year, we will present, formalize a 3-year community service plan in terms of the issues that have come up that were, gathered by the New York Academy of Medicine, and we'll put that into a report and in terms of, what the hospital will do in terms of tackling those issues.
All right. So maybe in the fall we'll get some kind of presentation on the preliminary findings of
Sure.
the health needs assessment.
Yeah,
All right.
absolutely.
I forwarded this email to everyone on the committee, so let's take a close look at it. I think it may be worth your while to participate. Oh, and eligible participants who complete the full survey will receive a $15 gift card.
To where?
That's well, for
Breakfast.
multiple options are available, such as Visa, CVS, DoorDash, and
Can you
more.
forward that to me as well?
Yeah, yeah. It's
Nobody
almost,
is the vice president.
it's better than, how much do you get for donating the blood?
$20.
Oh, it's not as good. It's not as good as that. Okay,
I have all
yeah,
business, Steve.
oh. Yeah, OC, what's your old business?
Okay, so the ASPCA gave us 4 spay neuter events in March, and I asked them to get back to me with the data. How many pets got spay neuter? How many, hopefully they track how many pets were not able to get fixed, but I'm really interested to know the numbers, to see if those 4 events that my understanding could hold anywhere between 25 to 30 animals were enough or not, and if they were not enough, how many more pets were looking to get services but couldn't get in. So that will determine how much and for what we need to push for the next, either a revised resolution or next resolution.
Yes, that would be very good information to have. And you told us, didn't you, that these vans were specifically targeted to our 4 zip codes?
Correct.
They were just looking for people, residents of our 4 zip codes.
Correct.
So-
That was for the month of March. And I also asked them for when is the next time they can give us a month of events. So I'm waiting for an answer.
And you think that it's possible that there might have been some number of people who were unable to be served?
For sure.
That-
For
that
sure.
They stood online and they couldn't take them?
No. No, this is not how it works. You had to sign up at 6 a.m. the day
Oh.
of the services, and if you
Ah.
didn't get a call, you didn't get services. So this is how they conducted that mobile van.
All right, so they should be able to tell us how many people called in and that they didn't give slots to?
I hope so, because that's a
Okay.
very important data.
All right, very good. All right, well, I know that you're gonna keep on top of them. All right, any other new business? Oh, no, that was old business. Is there any new business? All right, I just want to bring up, I'm still trying to get DEP to give us a presentation about the status of the water and sewer lines in our district and the work that they've done and the work that remains to be done. I'm somewhat disappointed. I was hoping to have that tonight. And I still don't have a response on whether we're gonna get such a presentation or what it might be. At this point, I don't know what to say, but the borough commissioner did get back to me and did say, well, they do have this other possible presentation, which apparently they're shopping around, called Flooding 101, which covers, in his words, all things flooding, resiliency and mitigation, types of flooding, for example, stormwater, groundwater and coastal flooding, climate changes, sewer backups and overflows, storm surges, hurricanes, blue belts, green infrastructure, coastal resilience and other resilience infrastructure. Seems like it might be worth a while to accept that offer. I mean, OC, what do you think? Do you want to have a presentation on?
Absolutely, yes.
Absolutely, yes. Okay, well, don't equivocate. I want to know exactly how you stand.
Steve,
Well, yeah,
how long have you been trying to get the sewer and water information?
well, I've been asking for it for quite a while, but, I really started up again in January, sending emails asking for it.
I would simply suggest if we go ahead with every correspondence you have with them, mention this.
Yeah. Well, I'm gonna get back, the borough commissioner, seemed to be somewhat responsive. The person I've been dealing with has lately been ignoring my calls. But, so I'm gonna go back to the commissioner. When I tell him that we're willing to do this presentation, I'm gonna tell him that this is not a substitute, for the one that I originally requested.
Exactly.
Figure out how to twist an arm while you're doing that, because
Okay.
that may well be their perspective.
Okay. All right, very good. And the other thing I wanted to mention is, which I also sent you an email on, is that I've been talking to Leo Jimenez, the chair of our Traffic and Transportation Committee, and to Jamila Sandoval of Councilmember De La Rosa's office, and Tanya Bonner from the Marching the Nights In with Task Force on Noise, about having a joint meeting of our committees to discuss issues related to the noise at pedestrian plazas. This meeting would be the same time as the usual TNT meetings. That would be Monday, May the 5th. But I need to know whether our committee members are available on that Monday. So Jody, you said you're available? Good, Carmen, you can do it? Richard, you said you could do it?
As of now, yes.
As of now? Well, let's keep it as of now. Jacob, you're okay on that date? What about Ms. Guzman?
I'm available.
Okay, very good. Anthony,
I'm okay too. I
Oh.
can make it. Thank you, Steve, for remember me.
yeah, I'm sorry, what's your name again? Oh, God, I'm sorry, Ocean. All right, well, that's great. So so I don't think we'll do any of the regular business that night. We'll just deal with that issue. And we'll come back to our regular schedule in June. That's my sense of things. Unless Julio has like a huge bombshell announcement to give us.
We'll work that out with the other committee chairs.
Don't hold your breath on that.
What is that, Julio?
Don't hold your breath on the bombshell
Oh,
announcement.
don't open. Okay, fine. All right. But you're always open to come to our meetings, and if you have something special to say, we'll quickly add you to the agenda.
Okay, that's good.
Mr. Alvin.
Move to adjourn.
Yeah, I'm sorry, you're out of order. Did you raise your hand?
You got my name right.
I did get your name right, yeah. Mr. Alvin, I now recognize you.
You already did.
Oh.
Find a second.
Okay, we don't need a second. This meeting, we have now concluded the business of the evening. Thank you all for coming. This meeting is now adjourned at 8:57 PM. Thank you
Thank you,
all.
guys.
All right, OC, take care of your husband.
Yeah.
Thank you.
Good night, everyone.